Welcome back to the Immigrants in the United States of America podcast, where we share helpful and transformative information for immigrants in the United States of America. Chapter 3: Navigating the U.S. Healthcare System. Insurance, clinics, and staying healthy. The greatest wealth is health. Virgil. Overview. The American healthcare system is complex, expensive, and confusing, even for people born here. For immigrants, it can feel like a maze without a map. Understanding the difference between a premium and a deductible, knowing when to go to an urgent care clinic versus an emergency room, and having a primary care doctor before you need one can save you thousands of dollars and potentially your life. This chapter demystifies healthcare so you can access it wisely, affordably, and without fear. Real-life scenario: Lynn avoids a $3,000 mistake. Lynn came from Vietnam and worked as a restaurant supervisor in Houston. When she woke up one Saturday with severe chest tightness and difficulty breathing, she immediately called 911 and was rushed to the emergency room. The diagnosis: a panic attack triggered by overwork. The treatment: 1 hour of observation and a conversation with a nurse. The bill: $3,200. Lynn had no insurance at the time. A colleague later told her that the urgent care clinic 2 blocks from her restaurant would have handled the same visit for $150 with no insurance. Urgent care is equipped for non-life-threatening situations. After that experience, Lynn enrolled in her employer's health insurance plan, found a primary care physician, and pinned the urgent care clinic address to her refrigerator. She also set up an emergency fund specifically for medical expenses. In their own words, a realistic dialogue. Lynn: I got a bill for $3,200 for a panic attack. I don't understand. I was there 1 hour. Coworker Rosa: Oh no, Lynn. Did you go to the ER? Lynn: Yes. I was scared. It felt like my heart was stopping. Rosa: For something like that, urgent care would have cost maybe $100 to $200. But you didn't know. Nobody tells you these things when you arrive. Lynn: In Vietnam, you just go to the hospital. There is one system. Rosa: Here there are 4: emergency room, urgent care, your doctor's office, and telehealth. Each one costs very differently. The ER is for when your life is actually in danger. Lynn: I wish someone had given me a map the day I arrived. Rosa: That's exactly what you should give to the next newcomer at this restaurant. 3 key tips and strategies. 1. Know the 4 levels of care. Emergency room: life-threatening, urgent care, moderate illness/injury, no appointment, primary care doctor, routine and prevention, and telehealth, minor issues from home. Using the right level saves enormous money and time. 2. Enroll in health insurance during open enrollment. If your employer offers coverage, enroll immediately. Even a basic plan prevents catastrophic bills. If you are not employed or self-employed, explore healthcare.gov or your state's Medicaid program. Many immigrants qualify for reduced-cost plans. 3. Negotiate and ask for an itemized bill. If you receive a large medical bill, call the billing department. Ask for an itemized bill, check for errors, and ask if they offer financial assistance programs. Most hospitals have charity care programs for people below a certain income. They are rarely advertised, but almost always available. Thank you for listening, sharing, and subscribing to this episode of Immigrants in the United States of America podcast. Check out the comments section of this podcast for helpful links to help you learn more and succeed in the United States of America. Thank you for joining us, and please come back next week for another helpful episode.